YouTube channel is just with you, and today we are discussing the health in the conflict zones and the special reference to organization which is called Safeguarding Health in Conflict Coalition. Uh, that is SHCC, and it is issuing the report since 2014. So it is almost 10 years, and according to this regards to the humanitarian side of the society or the nation or the country is neglected in the conflict or war zones, and almost the data is from 10 to 12 countries including Burma, Palestine, Syria, Yemen, Burkina Faso, Sudan. So this shows that the healthcare facilities are attacked regularly during any kind of the war, and the greater use of unmanned air vehicles, UAV. That is a kind in which the aircraft are small kind of moving objects or flying objects. We call it UAV, unmanned air vehicles. So these are basically terms used for the drones also, and it will have a capability of hitting the target as well as sensors and communication systems and even the weapons, as we are seeing in the conflict emerging between India and Pakistan. So there are many incidents in which it has been reported that not only the civilians or the army people are killed, but the healthcare workers, doctors, nurses, paramedics, they are also killed, and even patients are killed during the attack on the infrastructure of medical facilities. So two important things: first is the access, and second is the obstruction. Access during in the war zones or in the conflict zones, particularly communities residing near the borders or the hot lines where forces are using fire and artillery and other equipments. The access to the healthcare facility is very limited, including the essential drugs and normal care, including the normal checkups and visits of the hospital. Second is the obstruction of the health care. The people are ready to go to the health facilities because of the terrorist and violence activities and attacks fear. The health care is obstructed, so the hospitals are damaged, and second is the ambulances are damaged or the health transport is damaged. And apart from this, lot of injuries are there, traumas are there, burn injuries are there. Even now the pellets to shoot in the eyes is used, and even the bomb shells and other things can damage the building, so people can be buried, injured and suffocated. Apart from this, the health workers are also kidnapped, killed and taken hostage, or even they are arrested by the enemies or the groups which are violent in this nature. And the SHCC reported that almost 86% health facilities where it is hitting any target by drone or UAV, then 86% chances are that the health facilities and access as well as the normal supply of the infrastructure, medicines, doctors availability, and even emergency availability will be damaged. This is the WHO data. And last year, WHO has reported extensively on the Ukraine war, and every day almost one health facility is attacked, and same can happen if the war is escalated between Pakistan and India. Then our health facilities will receive the more damage. And one of the study shows that 42% primary health care facilities will be damaged during these attacks, and the most of the casualties will be in the secondary and tertiary or the urban centers. And we can have diagnostic and laboratory damage, as well as we can have the food chain, and even the healthcare manpower can be in short supply, particularly nursing and female staff shortage will be there. So I will request to the government of Pakistan and government of India that they should respect the humanitarian laws of the United Nations, and hospitals, schools, and other places which are religious places, mosques, or any other place like temples, they should not be attacked. And there should be some kind of propaganda and misinformation also. So our doctors, they should be using the proper channel of information, the national radio, national TV, not only the social media, Twitters and other accounts, so that we can have such kind, and even the WHO website can help them. So with this, I think one of the figures shows that in the last 20 year or year after that, in 2023, 2,562 doctors, nurses, SHCC, which is also a journal, Health and Human Rights Journal, they have reported that in 2023, 2,562 doctors, nurses, healthcare workers have been killed or kidnapped or injured. That figure is highest since last decade of 2024. With this, I think the communities living near the borders of India and Pakistan, their health facilities should be not attacked by any country, so that the pregnant ladies, the children, the civilians, doctors, they have nothing to do with the conflict or with the war. They should not be killed, kidnapped, or injured, or even they should not be harmed in any way. Dr. Hussain Bush Kolachi YouTube channel will provide you the latest. We have discussed this topic because of the prevailing situation between India and Pakistan. Please like it, share it. Thank you very much. My name is Dr. Hussain Bush Kolachi, and my YouTube channel is Dr. Hussain Bush Kolachi. 6343 is my handle, so you can access and you can like it, share it. Thank you very much.